access in communities across the U.S. with the help of our NCNW sections, states, our national affiliate organizations, and our national network partners. I'm Synovia Moss, and I have the pleasure of serving as the project manager for GoodHealthWINS. Why us? Why now? As reputable and respected, trusted voices and leaders in Black communities across the nation, we have the capacity to build and implement planned strategies, activities, and implementation plans to ensure that the barriers in health equity are addressed. We need to protect as many people as possible, especially our mothers and brothers and sisters and family members, particularly with new and possibly even more contagious variants of COVID around the horizon. This partnership will help support the long-term success of GoodHealthWINS as more trusted messengers and boots on the ground help to combat COVID-19. Thank you to our NPHC partners. We are better together, and we are all in to ensure that good health wins. And now, please welcome the Executive Director of the National Council of Negro Women, Ms. Janice L. Mathis, Esquire.
Good morning, and thank you, Ms. Moss, for that introduction. It is a pleasure to meet all of you, and I anticipate working with you to achieve our mutual goals. Dr. Marion and leaders of the 9 Black Greek organizations that we affectionately refer to as the Divine Nine, I greet you this morning on behalf of Dr. Janetta Betch Cole, our National Chair and 7th President, our Board of Directors, Executive Committee, our dedicated colleagues of the National Headquarters staff, including Ms. Rosalind Hannibal Booker, our imaginative and persistent Director of Philanthropy, and Ms. Crystal Ramsur, NCNW's brilliant Chief Administrative Officer. Our 30 state organizations, the NCNW National Health Equity Committee, ably led by Ms. Shara Denton, the 32 National Black Women's Membership Organizations who sit on our board and our affiliates, our sponsors, our 330 section leaders, Ms. Synovia Moss, the captain of the GoodHealthWINS ship, and the entire NCNW family. It is with great pride and anticipation that we are here today to announce another expansion of GoodHealthWINS, the Women's Immunization Network, and the NCNW family. Yet our pride and joy are made somber by the realization that we're in the midst of a pandemic that seems to have no end. After 6 months of effort and organizing, we realize that the task ahead is a daunting one. Each day, it seems, brings a new and tragic story of a family divided by disease and death. Every day, there are new deathbed pleas to survivors to please take the vaccine before it is too late. And each and every day, we are haunted by the thought that it did not have to be that way. If there is any silver lining to the dark cloud of COVID-19, it is that it has forced us to think about good health and immunization from a community perspective. And that community is the entire globe. Dr. Martin Luther King once said, we are caught in an inescapable web of mutuality. For us in 2021, that web of mutuality is a pandemic that knows no geographic boundary, no neighborhood, no skin color, no language, no logo, no organizational symbol, no religion. The coronavirus seeks whomever it can devour. The other thing we're learning through this pandemic is that science really does matter. Testing, contact tracing, public health measures, washing hands, keeping distance, vaccines and therapeutics with antibodies. Science matters a lot. For some of us, science is hard to trust because so much of it is microscopic and invisible to the unaided human eye. If we could see the droplets, we might mask up. If we could see the spikes, we might understand better how a vaccine could be developed to send a message to our cells to create a fake spike protein and then generate antibodies to fight it. It's a lot like faith. Both require us, both science and faith require us to believe in the unseen. The other thing we were surprised to learn is just how many surprises there are. You know, we now know that it's much more dangerous for a pregnant woman to skip the vaccine than to take it. We now know that the protection from the vaccine is stronger than the protection from having had COVID. For months, we talked about hesitancy. We now know it is safe for children over 12 to take the vaccine. Because science is driven by data, things change as we learn more and gather more data. And perhaps the most important lesson we are now understanding is that it is personal communication, one-on-one, in small groups, with family members, friends, that reaches people who are uncertain, unsure, and hesitant. That is why today we are so proud to be aligned with and allied with the Divine Nine. And they are already doing the work. They are in every city, every state, and beyond the borders of the United States. Their strength and influence and durability have been tested and proven over decades, for more than a century. So this morning we salute the Divine Nine and look forward to learning from them, collaborating with them, and working shoulder to shoulder to bring this pandemic and the next pandemic to a close.
Thank you. Please welcome the president of the Council of Presidents for the Black Greek organizations, Dr. David Marion, Grand Basileus of Omega Psi Phi Fraternity Incorporated. Dr. Marion.
Thank you so much for that generous introduction. We're certainly glad to be a part of this and to be partnering with you, the Divine Nine, all of our organizations with a membership of about 2.5 million members with a reach of about 7 to 10 million individuals. We have enjoyed a great relationship amongst each other during this particular time. As I was thinking about this press conference earlier today, I was thinking that on March 1st, all of the Divine Nine presidents, March 1st of 2020, we were in Selma, Alabama, to commemorate the 55th anniversary of Bloody Sunday. And all of us were there in person, and we walked across the bridge together. And we just talked about the importance of recognizing and being part of those kinds of events, only to go home that week and learn that we were in the midst of a pandemic. And we have not physically been in each other's presence as a group since then, that 18 months ago. But we did pivot during an election season. We pivot as we always are able to do as leaders, and decided to take this head on and start talking about simple things such as social distancing, wearing your mask, washing your hands, and sanitizing your hands. We did that from March of 2020 all the way through December. Then we made another pivot. We started talking about the vaccination and giving accurate information on that. When I say we're talking about all of our chapters and all of our members and all of our areas that we are in. And of course, after that, we started talking about vaccine hesitancy and the importance of still doing all of those things we talked about from March until December, even though you're vaccinated, and trying to make the proper decisions as we could as it relates to in-person meetings and doing some of our community service events. So we've been out on the forefront trying to get out the messaging. We put out messages ourselves personally to our members and across this country of the importance and the danger of this coronavirus and the dangers that we see now as all of the variants that are coming on board. The Divine Nine has its own COVID-19 task force. We've taken experts from each of the Divine Nine organizations to kind of lead that effort. So we're excited to partner with NCNW on this effort to continue those works in our communities.
Thank you, Dr. Marion. And if you may, please introduce the presidents who are present with us.
Be glad to. Let me start with Beverly Smith, National President and CEO of Delta Sigma Theta.
Thank you, Fred Marion, and good morning to all of you. And thanks to NCNW for pulling us together. You know, NCNW has a special place in our hearts with Mary Bacall Bethune, Dr. Dorothy Irene Height, Ingrid Saunders, Janetta Cole, Sora Matthews at the head of this organization. Any support that they request from us, you know, we're always there for. There is a quote that says, "Good health and good sense are two of life's greatest blessings." Coming together in the Divine Nine to really focus on good health and good sense, because in these days, it takes good sense to understand that you have to listen to the science and pay attention to what needs to be done if we are going to be safe from the COVID virus in the future. The future is upon us. We as Black people have been affected more than others. If that continues on, we've got to make sure we take care of ourselves. The biggest impact and the greatest concern, I know one of my greatest concerns is the impact on our children and on my grandchildren and our grandchildren. We have a responsibility to come together as organizations to make sure we put a strong message forward. The program that NCNW is working with and that we're partnering with in terms of winning in good health is critically important. I am proud to say that I am a president in this Divine Nine group, these incredible leaders that we have coming together to work together to try and be an example to others. Along with that example is the fact that we are all working towards vaccination, making certain that it happens, making sure our communities are educated. Let's make sure we continue forward on good health. Let's make sure we use that good sense, I hope all of us are blessed to have, to make sure the message is strong as we work together and partner for this incredible supportive initiative. Thank you for the opportunity to say a few words.
Thank you, Madam President. Next, we'll go to the International President of Zeta Phi Beta Sorority, Valerie Hollingsworth Baker.
Thank you, and good morning, everyone. And thank you, President Marion, for that wonderful, what would I say at this point? Just knowing that what you said has brought so much to mind as far as Zeta Phi Beta Sorority Incorporated. We are proud to be part of this incredible experience where we are now partners with NCNW and dealing with Good Health Wins. We've lost so many of our members, people in our communities, our families, over this dreaded disease. What we have to understand now is that we are here to make sure that we spread the word and to educate not only our members, but people in our communities and our families on what it's going to take to make sure that we can survive, that we can move forward, that we can do this and be ready for whatever comes. We need to make sure that when we spread this word and we are out there on the forefront, that we are there to make it easier on the next set and the next generation. This is so very important, and Zeta is there on the forefront, and we pledge our assistance to this most important initiative. Janice Matthews, she has been there. She has worked hard to bring us all together. Dr. Cole and everyone at NCNW, we thank you for bringing us together. We thank you for making sure that we are a part, that our voices are there, that 2.5 million members that President Marion has talked about, that they are on the forefront working for the betterment of what we call the United States, the citizens of the United States, and the world, because that's where we are. We're at a war right now, and we have to spread the word to make sure everyone is armed with the facts. And I know we will continue to do that through Good Health Wins. Thank you.
Thank you so much, Valerie. Next, we'll go to Cynthia Howell, who is the Executive Director of Alpha Kappa Alpha Sorority Incorporated. She is standing in for Dr. Glenda Glover, her International President.
Good morning, Dr. Dr. Marion, and good morning, everyone. My name is Cynthia Howell. I'm the Executive Director of Alpha Kappa Alpha Sorority. And on behalf of our International President and CEO, Dr. Glenda Glover, our Board of Directors, and over 103,000 active members, we are so proud to be a part of this initiative. As evidenced by our Mississippi Health Project that took place during the Great Depression and the Jim Crow South, Alpha Kappa Alpha has been at the forefront of voluntary public health works and bringing awareness to our communities about the importance of immunizations and vaccinations. Over the past year, we have conducted town halls and awareness campaigns. We have even taken our mobile mammogram unit across the country and partnered with organizations such as Abbott Labs and Walgreens to conduct free mammograms, COVID testing, and COVID vaccinations. And in the spirit of our original Mississippi Health Project, we are headed back to the Mississippi Delta in mid-October to offer these same services. You may have heard on the news this morning that Johns Hopkins just announced that the United States now has over 675,000 COVID-related deaths, marking this the most deadly outbreak in recent American history. We must use every tool in our toolbox to combat this pandemic, and this means social distancing, masks, and vaccinations. Alpha Kappa Alpha stands ready with our partners, our D9 partners, to do everything in our power to help make our children, families, and communities safe and healthy again. Good health wins. Thank you, Dr. Marion. Thank you, NCNW.
Thank you so much, Cynthia. I did not see, I think Rashida is still trying to, President Liberty from Sigma Gamma Rho, or one of her designees is still trying to get on. So I'm going to go to Chris Ray, who is the International President of Phi Beta Sigma.
Good morning, everyone, and thank you so much, Frater Marion, for the introduction, and of course, to the wonderful women of NCNW for your commitment to good health. I'm new to the Council of Presidents, being the newly elected International President of Phi Beta Sigma, so I'm the newbie on the block. But one of the things that I can say, as I sat in the chair as first Vice President of Phi Beta Sigma, we saw the work that was being done by the Council of Presidents and making sure that our community was being educated and that the impact was being felt by our organizations across the country. I would be remiss if I didn't say that it was an honor and a pleasure to work with our brothers of Alpha Phi Alpha as we were preparing for our international conferences and trading back and forth best practices as we came together for our national conventions, and proud to say and report that none of us had any COVID-related cases after our conventions because of that collaboration. And that was because of that education that we were able to share with one another. And so today, as we come together to support not only this great initiative, but showcasing the power of how, when we stand together, what is possible. And so we're excited and proud to stand with NCNW, look forward to taking the word out to our communities that vaccination is the key, and making sure that we do everything we can to educate our community and make sure that folks know what is possible when we come together. So Phi Beta Sigma, of course, is proud of the work that we have done over the last year in educating our members, very similar to all of our organizations as we focused on town halls and awareness campaigns. We're currently right now prepared to go into another direction as we educate parents K through 12 about the importance of COVID-19, about the vaccination that we know is coming down the pipeline for young people. And we're taking all our directors of education and utilizing them to get onto the communities and making sure that we spread the word. Our social action team, of course, continues to pound the pavement with our collegiate brothers, making sure they understand the importance of being responsible while they're on college campuses. And making sure that they're taking the proper steps. And so we know that together, all of us working together with the same message can make the impact that's going to make a difference in our communities. Again, looking forward to this partnership. Thank you for the time. Looking forward to this engagement. Thank you all.
Thanks, Chris. Next, we'll have the immediate past Grand Polaris of Iota Phi Theta, Andre Manson. He's sitting in for Sean Housen, the international president. but it's a great stand-in because it was under his leadership that he committed Iota Phi Theta to this initiative. So with that, I give you Andre Manson.
Good morning. Thank you, Dr. Frattamarian, for a great introduction and to the wonderful group of the NCNW. I'm gonna cut straight to the point with this Iota Phi Theta. We all understand that we need to roll up our sleeves, both figuratively and also literally, as it pertains to the health of our communities and our people. Really, whether you believe it or not, of the medication and all the propaganda around it, that's really not as important as what we know for sure. And what we know for sure is that this disease is claiming the lives of our people, and we can't take that lightly. Henceforth, why Iota Phi Theta has teamed with the NCNW and this cause. So that's all I really want to say. So on behalf of our 23rd International Grand Polaris, Sean D. Hauser, Iota Phi Theta is all in with this program. Thank you.
Thanks, Andre. Next, we'll have John F. Burrell, who is the Executive Director of Kappa Alpha Psi Fraternity. He is sitting in for the Vice Chair of the Council of Presidents and also the International President of Kappa Alpha Psi, the Grand Pomarch. So with that, I will give you John Burrell.
Thank you, Chairman Marion, Dr. Chairman Marion. And good morning, everyone. On behalf of Reuben A. Shelton III, Esquire, Grand Pomarch of Kappa Alpha Psi Fraternity Incorporated, and the Grand Board of Directors, good morning. This partnership with Good Health Wins amplifies the importance of collaborations. It provides the opportunity to share with others that look like us and don't look like us, to spread the word about the great work of each of us. We stand together, ready to work with our D9 family and the Good Health Wins extended family. A proud moment for Kappa. A proud moment of the St. Louis, Missouri Alumni Chapter to provide over 10 million masks in partnership with the National Urban League during the critical times of COVID-19 is a highlight of some of the great work of our individual chapters. Again, thank you so much. The honor to be able to work together is extremely important, and we're ready to work. Thank you.
Thank you, John. Next, we have Sean McCaskill, who is the Executive Director of Alpha Phi Alpha Fraternity Incorporated. He is sitting in for the General President of Alpha Phi Alpha, Dr. Willis Lonzer. Sean, I'll hand it over to you.
Good morning, everyone. What a blessing to be a part of such a event and a partnership. First, I would like to say to the ladies of the NCNW, what an outstanding job that you're doing. I love your energy. I know us partnering with you, I know we're going to make a difference in a lot of people's lives. I would like to bring greetings on behalf of the 36th General President of Alpha Phi Alpha Fraternity Incorporated and the Board of Directors, Willis L. Lonzer. One of the things that we've been really concentrating on now, we're into a big effort of educating our chapters and our brothers about COVID-19. The General President has created a position called the Surgeon General, who will lead this effort. We've been doing monthly webinars, educating our members as it relates to this disease, and this disease and how it affects our communities. So now what we're doing now is just really focusing on educating our members. Now we're going to go out into the communities and then make a difference in the communities. And a lot of our chapters, we're also doing policy work as it relates to it, to make sure that our government officials understand the importance of it and stop playing politics with such a dangerous disease. So right now we're so ecstatic about being a part of this partnership, and we look forward to working with the other Divine Nine organizations. And I think the communities would do justice by seeing such a collective, how the power of the collective of the Divine Nine and what we can do when we all stand together for such a something that's really affecting all our communities.
Thanks so much, Sean. So I think Synovia and Janice, you can see that the Divine Nine is on fire. We continue to do the work we've been doing over 100 years in our communities The focus now is getting out messaging as it relates to COVID-19 and the vaccine. So thank you so much for this partnership.
Well, you're awfully welcome. And I will tell you, when we started on this journey, one of the first things I did was peruse your websites, each of you. And it became apparent immediately that you were already doing the work. I said, we've got ties. The women who are presidents of the sororities are already members of our board of directors. And so it just made all the sense in the world for us to join forces because we know that a team together, everyone accomplishes more, and that's our charge. So thank you, and we appreciate your being here today.
And a very special thank you to Dr. David Marion as the president of the Council of Presidents and all of the national presidents of the Divine Nine for your leadership and your commitment to both NCNW and Good Health Wins. Through this journey together, we're going to increase partnerships. We will have the opportunity to do joint educational campaigns and lots of activities, events on the ground. But most importantly, we're here to educate, to inform, and to help our communities across the country to get the vaccine and to get shots in arms so we can get through this pandemic. If you'd like more information about NCNW, you can go to ncnw.org or Good Health Wins at goodhealthwins.org. And at this time, we'd like to take questions if anyone from the media would have questions. Mr. Johannes, you'll have to help us navigate this piece.
If you are from the media, please use the reactions button to raise your hand, and we will give you the microphone at that point to ask the questions to our panel.
Well, again, as we're waiting, if anyone has any questions, we ask that you put, if you're with us today, please put your information into the chat, your name, your organization, and or the city that you reside. Please know that NCNW and our collaborative partners, our network partners, and especially our partners of the Divine Nine, we're here to assist, and we're committed to making sure that we are on the front lines as trusted messengers to give accurate information and to make sure that we can assist you in knowing where to get vaccines. And if you would like to join us, we have our Uber Free Rides program, which will enable you to get rides to vaccination sites as well as testing in locations as well. With that, if no comments or questions, we'd like to thank you for joining us for today's press conference. This recorded session will be uploaded to our website, and we look forward to working with you. And together, we know that we're better together and good health wins. Thank you.
I would make one final comment, Ms. Moss, and this is by way of an announcement. This Saturday, which is the 25th of September, right here in Washington, D.C., where many of the Divine Nine have their headquarters, we will be conducting and participating in a walkathon and health fair and vaccine opportunity. The city of D.C. has consented to provide vaccines to anyone who wants them, free if you're age 12 and older. Come out to RFK Stadium in Washington, D.C. from 10 a.m. to 2 p.m. and receive information. There's prizes and gifts and fun and exercise, but also an opportunity to be vaccinated if that is your choice. So thank you, everyone.
Thank you. Stay safe.
Thank you.